As dental professionals, we know that high-quality instrumentation is essential for providing optimal patient care, ensuring clinician comfort, and maintaining efficiency in our workflows. However, many practices do not have a structured annual instrumentation budget, leading to inconsistent instrument quality, unexpected costs, and inefficiencies in patient care. In this session, we'll explore how planning your instrumentation investment can improve clinical outcomes, streamline operations, and achieve team satisfaction. I've created several resources to help you plan and implement an effective instrumentation budget and some examples of cost-effective instrumentation systems. You can access these through the link provided here or the QR code. And I encourage you to download them and print them and use the instrumentation budget calculator for reference in your practice. Use them to facilitate discussions with your team and decision makers, ensuring everyone is aligned in prioritizing high-quality, cost-effective instrumentation solutions. Let's work together to enhance efficiency, elevate patient care, and optimize practice investments. So in this session, we are going to understand the importance of budgeting, recognize how an annual instrumentation budget impacts clinical outcomes, operational efficiency, and team satisfaction. We'll develop a comprehensive budget plan, learn the steps to assess current inventory, determine needs, and calculate annual costs. Calculate per patient costs, break down instrumentation expenses to demonstrate affordability and efficiency on a per patient basis. And we will create and present a compelling case. You will gain skills to present a well-structured case to decision makers, showcasing the current challenges and proposed solutions. Utilize provided tools. Leverage the worksheets and templates to build a customized instrumentation budget for your practice. And attract and retain talent. Explore how a commitment to instrument excellence can enhance recruitment and team satisfaction. So why an instrumentation budget matters? Having a structured instrumentation budget is not just about managing expenses. It's about ensuring consistency in care, efficiency in practice, and clinician well-being. Consistency in care ensures the availability of sharp, well-maintained instruments, leading to better patient outcomes. Operational efficiency reduces downtime caused by inadequate or poorly maintained instruments. Team satisfaction. Hygienists feel valued and supported when provided with high-quality tools. And attracting talent demonstrates a commitment to excellence, which appeals to potential hires. When instruments are well-maintained and regularly replaced as needed, they allow for optimal patient outcomes, reduced clinician fatigue, and a smoother workflow in the practice. Without a budget in place, many offices struggle with inconsistent instrument quality, leading to dull or ineffective tools that compromise both efficiency and patient comfort. Clinicians may feel frustrated with worn-out instruments, which can lead to longer appointments, increased strain, and even the risk of injury over time. An annual budget allows you to plan proactively rather than reactively, ensuring that instrument quality remains a priority rather than an afterthought. It also supports team satisfaction and retention, as clinicians are more likely to stay in a practice where they feel valued and provided with the best tools for success. Investing in an instrument budget isn't just a financial decision. It's a commitment to clinical excellence, operational efficiency, and professional well-being. So let's take a look at the steps to plan an instrumentation budget. First, we want to assess current inventory. Begin by taking stock of your existing instruments. Identify the number of kits available, their condition, and which instruments are nearing the end of their lifespan. Use an inventory log to document this information for better tracking. You can use something like this, or depending on the size of your practice or facility, you may want to consider LM's tracking system, which is a specialized software. Next, we want to determine the needs. Evaluate your patient load. and the number of clinicians using instruments. Ideally, each dental hygienist has their own sets of instruments that only they use and maintain. Consider how many kits are needed to ensure proper rotation and minimize premature wear. If your practice has a high volume of patients, ensuring a 1 kit per patient per day system can extend the life of your instruments. This is an example of how kits can be created using the periodontal classification system. I developed this decision tree to simplify instrument selection and streamline clinical workflows. By aligning instruments to specific periodontal classifications, clinicians can improve efficiency by ensuring they have the right tools for the right case, whether it's gingivitis, early periodontitis, or advanced disease. Customize kits for different levels of care, such as initial therapy, maintenance, or advanced periodontal cases. The decision tree serves as a guide to help you organize instruments systematically, ensuring consistent patient care while reducing guesswork and stress during appointments. This example is using the LM Dental Sharpen Free line. And this one is with the LM Duragrade Max stainless steel line. I will send you these. So you have two options to streamline your instrumentation. You can use the pre-made decision tree that I've just developed and shared with you, or you can use these customizable worksheets to create your own kits tailored to your practice's unique needs and preferences. Both approaches ensure you have the right instruments for the right cases, helping you deliver efficient, consistent, and high-quality patient care. So next, we want to calculate the annual costs. Include all the costs associated with instrumentation for the year, such as instrument purchase or replacement. You could be using the sharpen free versus a sharpenable. How about the sharpening costs? Time, labor, supplies, and tools for sharpening instruments. Or whether you send them out as well for sharpening or you're paying someone in your practice, determine your sharpening costs. And then let's take a look at the sterilization costs. Many areas now we have to sterilize our instruments, sharpen, and then re-sterilize. So we have all these additional costs as well. Many can no longer sharpen chairside. So when considering the financial impact of instrument maintenance, it's important to break down the true costs, not just the upfront investment, but the ongoing expenses related to sharpening, supplies, and labor. This graph illustrates a cost comparison between traditional sharpenable instruments and sharpen-free instruments over time. For sharpenable instruments, we're looking at a scenario where a practice has 8 kits, each containing 5 instruments. That's 40 instruments total, at approximately $80 per instrument. Factoring sharpening time, this is an example of a dental hygienist sharpening all the instruments with just 1 hour of sharpening every 2 weeks. Where in reality, it probably is going to take more than 1 hour. On the other hand, sharpen-free instruments come at a higher initial cost, but eliminate sharpening-related expenses entirely. In this example, we're assuming sharpen-free instruments lasting for 1 year, bringing the annual investment to $4,400, 8 kits at 40 instruments at $110. And that's without factoring in special promotions or sales, which I always encourage clinicians to take advantage of, especially around conferences. So this is an example of $110 at 40 instruments. Now in this example, I'm illustrating a dental hygienist sharpening once a week for 1 hour. The previous one was once 1 hour every 2 weeks. So you can see that there is a higher cost overall with the sharpenable instruments. Okay, so we want to calculate the total number of patients per year, and we're going to multiply the number of patients seen weekly by the number of weeks worked per year. So here's an example, patients per week, 40. This is somebody who's working full-time. Weeks worked per year, this is just showing 50 weeks. It could be one operating at 50 weeks per year. So then we take the 40 patients per week, and we times it by 50, and we have 2,000 patients per year. Next, we want to divide the annual costs by total patients. So divide your annual instrumentation cost by the total number of patients to find the cost per patient. So here's an example. For the sharpen-free instruments, the annual cost was $4,400. We see 2,000 patients a year, so we divide 4,400 divided by 2,000. The cost per patient is $2.20, and I like to think of it as investment per patient. And the example for sharpenable instruments, annual cost with the sharpening and all the tools needed to sharpen and the time for labor, annual cost $6,200. Patients, 2,000. Cost per patient, 6,200 divided by 2,000. That's $3.10 per patient. Okay, so I've created an instrument calculator that I will send you along with a short video on how you can determine your instrumentation costs and break it down to the cost per patient. All you have to do is fill in the types of kits you have, how many kits you have, and how many instruments are in each kit, what is the cost per instrument, how many patients do you see a day, how many days do you work in a week, and how many weeks do you work in a year? And that'll break it down to the cost per patient. So I'm happy to share that with you, and that'll be found in the link that was provided at the beginning, and I'll also share it again at the end. If you're facing challenges getting approval for new instruments, here's a structured approach to make your case. First, set up a meeting. Meet with the dentist, office manager, and team to present your concerns and propose solutions. Collect your information. Document the current state of your instruments. Are they worn, ineffective, and unsafe? Gather evidence of how outdated instruments impact patient care, clinician fatigue, efficiency, and appointment time. Present a systematic plan. Propose implementing a systematic instrumentation program that includes regular assessment, maintenance, and replacement schedules. Show the pros and cons. Compare the cost of doing nothing versus the benefits of investing in quality instruments. And break down the costs. Present the cost per patient to show how minimal the investment is when distributed over time. And I will share this with you. You can use this as a template to create your own instrumentation proposal that you will present to your team. So by presenting a well-organized plan with data-driven insights, you can help decision makers recognize the true value of investing in proper instrumentation. The best part, you only need to make this case once. Once you gain buy-in, you establish an annual instrumentation budget, ensuring long-term efficiency, clinician well-being, and exceptional patient care. Now let's talk about attracting talent. The quality of a practice's instruments can be a deciding factor for dental hygienists when choosing where to work. Dental hygienists want to work in a practice that values them. Providing ergonomic, high-quality instruments reduces fatigue and prevents repetitive strain injuries, making your practice more appealing. Clinicians are more likely to choose and stay in a practice that prioritizes excellence. A practice that budgets for instrumentation demonstrates a commitment to high standards, setting apart in hiring decisions. Well-maintained instruments contribute to job satisfaction. When hygienists have access to the right tools, they can focus on patient care instead of struggling with dull, ineffective instruments. When interviewing potential hires, highlighting your commitment to instrumentation excellence can be a unique selling point. In a competitive job market, this investment not only improves patient care, but also makes your practice stand out as a top choice for dental professionals. So in conclusion, investing in an annual instrumentation budget is more than a financial decision. It's a strategic commitment to elevate practice, ensure consistent clinical excellence, and enhance team satisfaction. With the tools and strategies shared today, you are now equipped to take the first step toward implementing an instrumentation budget in your practice. Remember, a small investment in planning now can yield significant benefits for your practice's success and reputation in the future. So please visit this website here or scan the QR code to receive the resources. Thank you for joining me. I truly appreciate you taking the time to be part of the session on planning your annual instrumentation investment. I hope we can stay connected. Together, we can continue to elevate the profession and ensure that both patients and clinicians benefit from the best tools possible. Thank you again for being here, and I look forward to staying in touch.